Hey, Janessa,
Yeah.
I keep hearing about Zantac.
Oh, yeah. There's something with the medication. The
Everybody
FDA
I know
doesn't really
takes Zantac. All these people take Zantac.
I know, especially since it's like over the counter.
Lots of Zantac. Maybe we should talk to some of our pharmacists and experts about it.
I think that's a great idea.
Will you talk to them? Get back to us.
Absolutely.
Welcome to Working Smarter, Concise Compliance Conversations featuring Wendy Rubis, sponsored by VillageMD, primary care physicians, practice medicine the way you've always wanted, data, resources, and clinical decision support to care for your patients inside and outside the exam room.
Hi, welcome to Working Smarter. This is an advisory notice about a recent medication finding that we've been seeing in the news about Zantac. And so we brought in two experts from VillageMD to talk with us a little bit about this important topic. So we're joined by Prasanga Lokuge, who works at VillageMD within our product team, and also clinical and quality safety. And then we also are joined by Saba Syed, who is a clinical pharmacist down in Houston who also works with VillageMD. Thanks so much both for joining us.
Thank you for having us.
So talk to me a little bit about what's happening. I'm seeing things from the FDA. I'm seeing things from manufacturers. What is happening with Zantac?
So the FDA has announced that some ranitidine medications have been recalled. There's multiple voluntary recalls also going on, and this is due to a finding of low levels of a nitrosamine impurity called NDMA, so N-nitrosodimethylamine, which is classified as a probable human carcinogen. And the FDA right now is still just trying to evaluate what's going on. They don't really know if the impurity is actually linked to any kind of cancer right now. So they're just trying to find out more about what's going on, and they're actually continuing to test more lots of medication.
So ranitidine, as I understand, is the active ingredient. It's also the name given to the generic forms of Zantac. Are there other names that they go by that physicians and consumers should also be looking into?
Yeah, absolutely. So it can be a little bit confusing because ranitidine, like you mentioned, is the active ingredient in the product, and the brand name is Zantac. However, a lot of pharmacies have their own brands of products as well. For consumers, it is important to just basically turn around the bottle and see what is the actual active ingredient in their over-the-counter medications. If they're getting it through a prescription, then of course on the prescription bottle, it is going to say ranitidine on it.
What exactly is happening that's causing this to be considered a possible carcinogen? I don't want to get too much, in the weeds of exactly the science, but why is this considered a possible carcinogen?
Yeah, so right now we don't really know. The FDA is still investigating. They're still trying to determine the root cause of the NDMA. Right now, there's basically two hypotheses or possibilities. The first one is that the NDMA might be contaminant or some type of byproduct in the manufacturing process. And the other possibility is that it could be an in vivo byproduct of the ranitidine molecule itself.
Just to clarify a little bit. So one is like it's the manufacturer's fault for this NDMA versus one is like this is just sort of within the chemical itself and like as it breaks down it produces this. Is that what you're saying?
Yeah, those are the two hypotheses right now, and we just don't know what it is at this point.
But overall, there are quite a few manufacturers who are just doing precautionary recalls because they don't know. Is that correct?
Yeah, so there were the two manufacturers that did have the confirmed contamination of the NDMA. And so they have recalled the products. So that's the Sandoz and the Dr. Reddy's. They actually did detect the NDMA impurities. The other manufacturers that are pulling the products are just doing it as a precautionary measure, just out of an abundance of caution, because again, we don't know what is causing the NDMA impurities in the products. So they're just choosing to just proactively pull the products off the shelf.
That's a good segue into this next question is what is being done? So we know that the FDA is looking into this, but what should we do in the meantime?
I would say it's probably best to avoid the ranitidine for now. If patients are taking medication and it has not been recalled, it's probably safe for them to just continue to take the medication. The FDA has stated that if you're on the medication and you're currently taking it, there's no need to just stop taking it. At least from the patient point of view, they shouldn't make any changes on their own without consulting their physician or talking to their pharmacist first. So there has not been like a widespread recall of all ranitidine. And like we mentioned earlier, it's certain manufacturers, certain lots, certain brands. So patients that are affected will more than likely get some kind of a letter from their pharmacy or some kind of notification.
Many providers listening to this podcast are probably wondering, so what do I do in the meantime? And what's my responsibility in reaching out to the pharmacy? And how does the pharmacy and the provider work together on this? Any thoughts on that?
Yeah, I would say, like, from a provider point of view, because you don't know what manufacturer was dispensed at the pharmacy. If you're fielding a lot of calls from like worried patients, the first thing I would say is have the patient talk to the pharmacy that dispensed medication, because most of our patients are not using our pharmacy. So even though I could get you the information on what brands we carry, there's so many other pharmacies that our patients could be going to. So if they have a question about whether or not the specific product they have in their hands is safe or not, the best source of that would be just go directly to the pharmacy, and they will tell you if your manufacturer has been or has not been affected by the recall. However, if the patient is just not wanting to be on this medication anymore because they're just worried about the risks, or they would rather switch to something that is potentially safer, you just have to be kind of on the lookout for drug interactions or cautions for that class of medications. But an easier switch would probably be from ranitidine to famotidine, because those two are so similar, and you wouldn't have to, reevaluate the risk versus benefit at that point for that class of drugs.
Yeah, so that's a really good point. So any patients or just general people who are listening, there are other medications that are similar to Zantac that don't have this issue. And so you should talk with your doctor or pharmacist about those specifically. You may be able to switch pretty easily if you're very worried. Additionally, for any of our physicians who are working with us, we have a notice that you can put up in your office to notify patients about this issue and what they should do.
If patients are taking Zantac over the counter or off the shelf, and especially if they haven't maybe talk to their doctors. A lot of people do kind of just start taking medications and don't tell their doctors about it. There's so many other over-the-counter options now. Suggest, for patients to definitely tell their pharmacist or their physician if they're planning to switch products, because like I stated before, not all drugs are created equal. So for example, you can't just switch from one to another without at least having some type of conversation with a clinician, and don't just switch your drugs without at least talking to somebody, because there could be potential interactions with any of these other medications. And like I mentioned, the Pepcid would probably be the safest switch. However, the patient shouldn't just assume that. They should definitely talk to their doctor or their pharmacist first.
Your comment is a great reminder to our clinic staff to proactively always ask when patients are taking drugs over the counter. Oftentimes during, let's say, a medication review, when they're being groomed by our MAs and nurses, they tend to forget to mention OTCs. Your comment is a great reminder to our clinic staff to proactively always ask during the medication review process what OTCs they're taking. Probably the best way to get something like a Pepcid onto a patient's medication list.
Yeah, absolutely. And people do forget.
Yeah, that was a great point. So just to sort of recap everything that we talked about, there's a concern that NDMA is potentially carcinogenic. The FDA is currently investigating, but they don't know all of the information yet. Some manufacturers are doing precautionary recalls, and you should find out from your pharmacist or from your doctor if one of the manufacturer Zantacs that you're taking is being recalled or not. You should receive a letter from the manufacturer or the pharmacy, but also be proactive and ask. There are options to change to other medications if you're interested in just not taking Zantac at all. But you should talk with your doctor or a pharmacist before you switch, because there could be potential interactions with your other medications. If you are taking over the counter, it may be helpful just to talk with a pharmacist or a doctor at all about what you're taking and making sure that this is not going to interact with your other medications. And we'll continue to update you as we learn more from the FDA or if we learn more from the manufacturers. Thanks everyone for listening to Working Smarter. We just want to make all of our listeners aware that we're recording this at the end of October 25th. And this story is rapidly changing and developing as time goes on. So there may be more manufacturers that get listed. The FDA may release further information, and we will keep you updated on any of this information as we hear about it.
Thank you to our sponsor, VillageMD. We hope you will join us for future concise compliance conversations.